Thanks so much for having me today. I'm Dr. Turner with Cardinova and Previa Health. Really excited today. We saw an awesome patient who is a gentleman competing for a national championship in Spartan Race, which is a well-known obstacle course race. So a couple pictures I just wanted to show to kind of discuss what we were doing. So we had the opportunity to use two different kinds of laser wavelengths today. And the first one was really inserted basically through this 18 gauge needle, which is kind of this pink needle that you see behind you. And what that allows me to do is actually to use a mechanical type of mechanism to treat the cartilage surface of the inside of the joint. And in this case, this gentleman had an MRI, which kind of showed us he'd had some wearing of the cartilage on the lateral or kind of the outside part of the knee from that big thigh bone, which is called the femur. And so the little place that we treat is something called a condyle. We had great visualization of that today between the use of X-ray and ultrasound, which is really nice because I think that got to keep the patient from having to have arthroscopy or basically to have a surgery where you have to put a camera in. So that was nice because we did that all with local anesthesia just here in the clinic today. Once we put that laser in, this is really the way that it works. So we have kind of three different mechanisms, and one kind of crucial distinction from other orthopedic lasers in the past is, this laser is not ablative. So we're really not overpowered to the way that it would otherwise destroy or harm tissue. But we do create a very small zone of coagulation. So you could think about it like, if I went out today, I'm a sprint and power athlete. If I tried to go run a marathon, I'd probably hurt myself. But if I go out and do a HIIT interval workout, in less than 30 minutes, which is something I'm used to doing, I'll kind of tear down my muscles a little bit, but I'll come back and I'll heal stronger. Similarly, with this kind of laser, we're creating kind of like a tiny bit of damage, almost like you're training your muscles real hard, and we're enabling it to then come back. And the other mechanisms you kind of see up here behind me are, you see the creation of what are called nanopores, right? So cartilage, unfortunately, doesn't get a lot of great blood supply. It doesn't communicate well with other cells, these little cartilage cells called chondrocytes. And so when we create these little nanopores in the cartilage, all of a sudden, it's like we have all these channels where these cells can communicate with one another. They can pass nutrients back and forth. So that was the second part of what we did. And then in the third part of this, you see the signaling. So as these cells increase their signaling to one another, this is obviously in a kind of like a petri dish or a lab setting, which is not the same thing as what happens in a human being all the time. But what you see is these cells kind of grow even within 10 days, right? And so that's what we're trying to encourage over a longer period of time. And one of the things that made me really excited to use this technology is because, we had a clinical trial that basically showed better cartilage signal. So if you're looking over here at somebody who got treated, kind of those white lines are really where you see cartilage on the edge of a knee MRI. And if you look on this side of me in the before picture, you see there's not a lot of white lines there between that bone of the thigh, the femur, and the tibia, that bone of the shin. And then you look on the left side, and that's only 6 months later. The patient was doing well, actually way before 6 months. It's really cool to have a picture and actually see that cartilage signal on an MRI is improved. And a lot of patients will ask me that. They'll say, well, if I come and get an advanced procedure, and maybe I'm trying to avoid a knee replacement or I'm trying to avoid another kind of cartilage surgery with a long recovery, are my pictures or are my MRIs going to look better? And I think before, the use of advanced biologics and the Regenolase laser, a lot of times you wouldn't see that, right? But this type of data makes you much more confident as a physician to adopt novel technology and to be confident when you speak to your patients about their chances to achieve their goals successfully and safely in a way that's really minimally invasive for them. And then, lastly is an approach with the spine that we really didn't do today because we were focused on a knee. But we've been looking, I think, in medicine. We see a huge number of patients who, get labeled or they get told they have degenerative disc disease, and they kind of don't always have a range of great options. Some of them get better with physical therapy and maybe with exercise and different kinds of medicine. And even if we do procedures to alleviate pain, most of the time we don't ever see cartilage signal or discs improve over time. And so these studies were done much farther out. Actually, the picture you see on the far side, on the right compared to the left, the picture on the left was 5 years out, which is pretty impressive because in medicine, there's a lot of things we do that maybe help people for a shorter period of time, but to have really long-standing interventions, I think is really the goal, right? Because if we have to do a procedure to help somebody obviously we want to be safe, but we don't just want them to get better this year, we want them to get better for the long term. And that's what I think the advent of the Regenerase fractional laser, with both kind of the surgical component that you can put inside of a disc or a knee, and then combines with what we call extracorporeal, basically the way you just hold a laser with a special handheld device next to the skin. The combination of those two mechanisms together are very powerful, and so we're excited to be able to offer it here.
That was awesome.